Hello, the name of this video is Syringe Feeding. My name is Raymonda Adams. I'm a certified lactation counselor and doula, and this is presented to you by the UB Maternal and Child Health Program. I'm going to reduce my video now so you can focus on the slides. Syringe feeding and early limited formula use, also known as ELF. A syringe is used rather than a bottle in order to avoid nipple confusion for the infant. This is optimal and reserved for premature and at-risk infants with a birth weight loss of greater than 5% within the first 48 hours of life. ELF use is the use of formula as a supplement to breastfeeding in the case of infants born very early or infants with various medical conditions. ELF will be discontinued when mature milk production begins and the breast milk can meet the infant's feeding needs. This typically occurs within 1 to 2 weeks of the premature infant's birth. Supplementing with formula via syringe. Sometimes supplementing is absolutely medically necessary. Some babies may need a little extra nutrition for the following reasons: low blood sugar levels, hypoglycemia. They may be receiving treatment for jaundice, and if they are not feeding well enough at the breast. Weight loss, where a mother's milk has not increased and baby doesn't gain weight despite frequent and effective breastfeeding. Dehydration, not enough wet diapers. Premature babies who are not feeding well enough at the breast. Meconium still being passed 3 to 4 days following the birth. And mother's milk has not started to increase by the 4th day. This video will discuss syringe feeding using a feeding tube.
Syringe feeding is an alternative to bottle feeding that you may need to do in the early weeks if you're trying to establish a successful breastfeeding relationship but have been told that you might need to supplement your baby. The reason to syringe feed rather than bottle feed is to avoid any confusion between the different kinds of nipples and the different way that a baby sucks while nursing and while bottle feeding. You may be advised to syringe feed for a variety of reasons. These could include reasons for the baby, poor weight gain, jaundice, or other medical issues, or could include maternal issues of having pain, difficulty with latch, or medications that the mother is on. To syringe feed a baby, you can probably get supplies from your local lactation consultant or hospital. This is a simple bottle that most hospitals carry, or you can get with a pumping kit. And then you get a syringe and a feeding tube, which can both be obtained, again, from your hospital or lactation consultant. Whoever has advised you the supplement should be able to help you find these materials. The best thing to use is expressed breast milk, and it's very important that if you are syringe feeding that you're also pumping if you're not putting the baby to breast. You would draw up the milk into the syringe. And then attach this infant feeding tube to the end. And the milk can then be pushed through the tube. The end of the tube has some small holes, and you would place it against the top of your finger. You want the soft part of your finger to be facing upwards towards the baby's palate and the nail bed to be facing down. It's very important that you've washed your hands well prior to syringe feeding a baby. The baby will then latch onto your finger in a very similar manner to how a baby would nurse. And it's important that then you push and allow the baby to get some positive feedback with either the breast milk or the formula when you're noticing the baby doing a suck and swallow to mimic a natural feeding. It may take 2 people to coordinate this at once at first, but after practice you should be able to do it on your own. Breastfeeding is challenging for a lot of moms, and it's normal to expect there to be a few bumps in the road. I encourage all of you to continue to work with your baby and your lactation consultant to develop a positive and healthy nursing relationship, and not to worry if you have a few setbacks along the way. It's very normal and to be expected.
So here's the procedure for syringe feeding your baby. Number 1, breastfeed your infant first if at all possible. If needed, begin the steps for supplemental feeding. Number 2, wash your hands with warm water and soap. Make sure fingernails are trimmed. Gloves may be worn if the mother prefers. 3. Draw 10 milliliters of prepared formula into the syringe and attach the feeding tube to the tip of the syringe. 4. Tape the feeding tube to the bottom or side of your finger. The end of the tube should not extend past your fingertip. 5. Brush your finger against your infant's lips to get them to open their mouth. 6. Slide your finger along the roof of the infant's mouth. The infant should begin sucking. Hold the syringe vertically with the tip pointing downward. 9. Do not push down on the plunger. The infant sucking will draw the milk out. 10. Increase or decrease the speed of formula flow by raising or lowering the syringe in relation to the infant's head. This video will demonstrate the procedure for syringe feeding using a feeding tube.
Start by drawing the milk into the syringe. It's best to use a syringe that's no more than 20 mils in size. The larger the size, the harder it is for the baby to draw the milk from the syringe. Attach the feeding tube to the syringe. Place the feeding tube along the top of the finger with the end at the tip of the finger. Tape the tube at the second knuckle. At first, this can be done with a partner. As the mother is more comfortable, she will be able to do it by herself. Push gently on the syringe to start the flow of milk. Use very slight pressure. Hold the baby at a slight incline. Touch the baby's lip with the finger so the baby opens its mouth. When the baby opens, introduce the finger with the tube at the roof of the baby's mouth. The pad side of the finger should be up against the baby's palate. Encourage the baby to take the finger all of the way into the mouth where the baby would suck on a pacifier or a lollipop. This is in the part of the palate that has an indentation. The baby's sucking will draw the milk out. You will not need to keep pressing on the syringe. We want the baby to eat comfortably and not be overwhelmed. Watch the baby's face for signs of stress, furrowing of the eyebrows, or wide open eyes. If the syringe is held above the baby's mouth, the flow will have less resistance and it will be easier for the baby to draw the milk. You can lower the syringe to slow the flow.
Here are some common procedure-related questions. What if a mother is uncomfortable using the feeding tube? If the mother is uncomfortable using the feeding tube, she may use only the syringe to feed the infant the supplemental formula. What if the feeding tube appears to be irritating the top of the infant's mouth? If the feeding tube appears to be irritating the infant's mouth due to rubbing, tape the feeding tube to the side of your finger to avoid contact with the roof of the infant's mouth. It appears that my infant is not receiving enough milk via the tube during the feed. How do I correct this? Try the following things. Check for bends or kinks in the feeding tube. Check the position of the feeding tube in your baby's mouth. Raise the syringe higher above the level of your infant's head. By raising the syringe higher above the infant's head, it will allow the infant to receive the formula faster. If your baby is getting the feeding supplement too fast, Lower the syringe so it is below the level of your baby's head. Cleaning the syringe and feeding tube. The steps to cleaning the feeding tube include using the syringe to push cold water through the tube to remove the excess milk. Use the syringe to flush the tube with hot soapy water and rinse well. Residual water can be forced out of the tube by shaking the tube in a lasso-type action. If reusable feeding tubes are used, replace with a clean feeding tube after 3 to 4 days. Conclusion. Syringe feeding is a great way to avoid the potential risk of nipple confusion while providing all the necessary nutrients your baby needs for optimal health. Your doctor, pediatrician, or a lactation consultant can help you decide which method will work best for you and your baby, and they can also help you locate and purchase special feeding equipment that you will need. Thank you.